May is Women's Health Month, and their health needs evolve with every decade. The Women's Health Institute of BayCare Health System provides quality care for every stage of life. And joining us to talk about how to stay healthy through the years, Dr. Megan Tirone, Vice President and Chief Medical Officer of St. Joseph Women's Hospital, Winter Haven Women's Hospital, and Women's Services for the Health System. I'm so glad you're here today, Doctor. How are you?
I'm great. Thank you so much for having me.
I love how we're approaching this. I mean, I still remember as a teenager, like that first, women's care appointment. So let's start there first, of course. Maybe that's the first time we start talking about women's health. Teens, 20s, what is the care like for girls, women at that stage of life?
So it's interesting, over the past several years, care for that late teen to early 20 patient has evolved a little bit. We no longer recommend that you get a pap smear and a pelvic exam until you're 21. But there are a number of things before the age of 21 that you can work with a healthcare provider in women's health. You want to talk about your cycles and your periods, and are they normal? Are you having excess pain or excess bleeding? How can that be treated? You want to talk about your sexual health. What feels good for you? What you need to do as far as screening and protection and preparation. We have so many great options now for contraception. Used to be all we could do was a couple different things.
Right.
Now we can really tailor it to what you're looking for and how you prioritize your health. So finding that women's healthcare provider that you connect with and that who can honestly answer your questions is really important even before you turn 21 and need that first pap smear.
Because those conversations, that honesty in the room is key. So starting off there, I think so important. Let's move to the 30s though. Does the conversation change when it comes to women's care for women in their 30s?
So in my 30s, I feel like I was swamped busy.
Yeah.
This is the time when you're thinking about starting your family, you're building and growing your family, you're taking care of your children, you're working and focusing on your career. You might even be taking care of your parents. Doing things that are healthy for you can sometimes be really challenging. Making sure you're getting moderate amount of exercise, those simple diet swaps to keep you healthy, focusing on your vegetables, your fruits, your whole grains, your healthy and lean proteins, and then continuing that conversation with your provider. Do you want children? Do you have any health issues? Do you have high blood pressure, diabetes? How can you maximize care for those conditions before you even approach being pregnant? Do you not want kids?
Yeah.
What's your best choice for contraceptive management in your 30s? So there's a lot to focus and prioritize on.
For sure. And of course, then if you are expecting, you're there, weekly. And so the conversations definitely pick up. But then the 40s happen. I'm an open book. I'm there. Talk about the conversations. I'm talking to my doctor all the time. Night sweat's not fun. I mean, that's just one example, I think, that you start to hear from a women's point of view in the 40s, isn't it?
We talk about menopause as though it's a concrete time. But it's really a period of time and change that expands over years. And that starts to begin in the 40s when your hormones begin to change and you're not producing the same levels of hormones that you did in your 30s. So it continues to be important, prioritizing moderate amounts of exercise, a healthy diet, taking care of yourself, your mental health, your wellness, and then being open and honest again with your provider about what symptoms you're having. We have much better ways to manage the menopausal transition in those years leading up to menopause than we used to.
Again, it's always changing. Well, I'm so glad we got to put the spotlight and kind of walk through women's health, walk through the ages, if you will, of course. And if you want more information, well, you can check out additional information and additional resources, of course, just by going to baycare.org.